Hello, I'm Eric Olander, Managing Editor of the China Africa Project website and podcast. On behalf of BAM, the Business Alliance Against Malaria, thank you for joining us for our first session of our Malaria webinar series. We'll be speaking with three experts today about the impact that COVID-19 is having on malaria programming around the world. But before we get started, let's learn a little bit about BAM as an organization. We're really at a crossroads right now, in part because over the past, say, 10, 15 years, we've made incredible strides at combating malaria, at really improving the quality of aid, the delivery of it, and the overall fight against it. But now, in light of everything that's been happening with the outbreak of coronavirus, so much of that is in jeopardy. There's an interesting data point that I came across earlier that nearly 75% of programs funded by the Global Fund said they were facing pandemic-related challenges. And that is going to be really the focus of what we're going to talk about today is, in light of these incredible challenges, where do we go from here? What does the world look like both in the midst of this pandemic and afterwards? Who are the stakeholders, the partners that are going to come together to help make sure that malaria and all of that stays current in people's thinking in terms of how we treat this illness? And we've got a great panel of people here to join us to talk about this. I'm very excited to have this conversation with them today in no particular order. First, coming to us from North Carolina in the United States, Dr. Rima Shreda is an honorary visiting research fellow at the Center for Tropical Medicine and Global Health at the University of Oxford. A very good morning to you, Rima.
Good morning. Thanks for having me.
It's wonderful to have you. And then also coming to us now from Singapore is Patrick Silborn, who is with the Asia Pacific Leaders Malaria Alliance. A very good evening to you, Patrick.
Good evening.
And a good afternoon also to Joy Pumapi, who is the Executive Secretary of the African Leaders Malaria Alliance and joins us from Francistown in Botswana. Good afternoon, Joy.
Good afternoon, and thanks for having me.
Well, it's wonderful to have all of you here, and we're really going to bring a global perspective and take advantage of your expertise from all these different parts of the world to talk about this. I'd like to start our discussion today with a lightning round. Very quick, let's not get into too much detail, but just each of you to quickly go through and tell us how you see the pandemic impacting the global campaign against malaria. Joy, let's start with you in Botswana.
Thank you. I'll talk about Sub-Saharan Africa rather than just Botswana. There are several challenges. One is we saw stoppages in manufacturing of commodities from countries like India, China, and then supply chain blockages in terms of getting the goods here to Africa and then moving them within the African continent and within countries. And we saw health workers shortages in that all the health workers were now concentrated on COVID-19. Lack of PPE, so that the health workers, even those who were still able to deliver malaria and other health services, did not have PPE. Funding shortages, COVID-19 preparedness and combating the epidemic is extremely expensive, so resources will be moved away from programs. So these are some of the challenges that we have seen and that have faced the malaria programs on the continent.
And Patrick, how about in Asia? What are you seeing?
Yeah, thanks, Eric. I think similar to what Joy has mentioned. We've seen case notification going down. That means that programs are finding less cases. In some areas, we've seen drops of 50%, and that is because of social distancing measures and because of lockdowns. We also know that in the Greater Mekong sub-region, so Vietnam, Myanmar, Cambodia, Laos, Thailand, village workers also unable to reach some of the communities, some of the catchment areas because of these measures, and also because of the lack of PPE, this personal protective equipment. But I guess we're really in the beginning of this, so time will tell. Another important challenge that I think we're all seeing is that governments are facing this double shock. Tax revenues are going down, expenditures are going up. So this will have an impact on public health and malaria budgets. Over to you, Eric.
Yeah, Rima, you from your perch at Oxford and looking at global health at large, what are you seeing?
Yeah, absolutely. So, I mean, of course, you know, this is the first time we've the world has been faced with a global pandemic, and in terms of, or at least in terms of the last 100 years, but in this particular case, we have identical symptoms to malaria: fever, headache, body aches, weakness. So there's a confusion at the level of the health worker and also the individual as well, in terms of whether to go into the health facility or not. When there's a lockdown, there's trouble in getting to the health facilities. There's access issues with health facilities. We saw this previously with Ebola, where you had cases of malaria going up at the same time as dealing with the pandemic. And then, of course, interruption of a lot of the programs, both case management, but also some of the prevention programs, treated net programs, indoor residual spraying programs. And then, of course, Patrick mentioned the issue of financing, lack of tourism, so lack of revenue at the level of the country. And then how do the health workers get to their workplace when there's a lockdown? There's also task shifting that occurs. So how do they manage then the multitude of issues, particularly at the level of a village health worker or a community health worker in an already stressed system?
So you all three have raised issues that in many ways, one alone would be serious, but the multitude that are together is in some ways absolutely terrifying. And in terms of the economy, the fact that the symptoms are so similar to one another. And Joy, in Africa, and again, you're in Botswana, but we're going to talk about sub-Saharan Africa writ large. There are a bunch of different issues that are going on here. And I suspect, Patrick, they're playing out very similar here in Asia as well. That there is a certain fear that people have about going to a health provider with symptoms that may be a fever, maybe, the symptoms that all look and feel like COVID. And there's a concern, Joy, that if people are seen to be potentially infected with COVID, they will be turned away or they will be stigmatized. Joy, talk to us a little bit about how you're seeing in sub-Saharan Africa the overlay between the malaria symptoms and the COVID symptoms that may discourage people from getting care.
This has caused a lot of confusion, and it has been very difficult to address. But there are some countries which are making headway in addressing it, like Zambia. Zambia has got an Anti-Malaria Council, which has got private sector members as well as public sector, civil society, traditional leaders. And the members of the council met and they decided to jointly develop an advert which went on public radio, which went on TV, which has had a huge impact on the reducing the stigma that is associated with COVID-19, but also getting people to understand how urgent it is to take a child to a health facility when they are presenting with a fever. And this has had a huge impact. But there are, of course, countries which are still struggling with this issue. But one of the most important challenges really is the shortage of PPE and the lack of training, adequate training of health professionals in the communities, so that they are the most important people to understand the difference between COVID and malaria, and appreciate the importance of getting to treating a malaria fever through case management as early as possible, particularly when children are presenting with severe malaria. So this has been the big challenge. But indeed, the stigma that is associated with COVID and the lack of uncertainty about what to do about it continues to haunt us.
So Patrick, it's interesting that Joy talked about the shortage of PPE and the skills deficit that exists in sub-Saharan Africa. Asia, in many ways, is a little bit of is much more diverse in terms of economic development. You've got Singapore and Philippines who are all together in ASEAN, not to mention Japan, China. There's a huge range. What's the situation in Asia Pacific in terms of those issues that Joy raised?
You know, I think it's a bit different given that the malaria burden is so much higher in Africa. Here in Asia, 50% of the malaria endemic countries actually report less than 10,000 cases a year. So many of the countries are on the journey towards elimination. Now, the issues that Joy mentioned about stigma, for example, it's really prevalent here as well. You know, it is stigmatizing to have COVID. I think you know, someone mentioned the other day that if you have COVID in Ho Chi Minh, they close down an entire block just because there's one case. So I think that would also make people a bit more reluctant to actually even visit health centers if they have fever. But one of the potential solutions, I mean, we had our malaria week last week, and we talked about how do we best preserve malaria funding in this new era, in this new situation. And one of the important topics that came up was about integration. People talked about that we can use this crisis almost as an opportunity to accelerate integration of malaria programs into national health systems. And that sounds a bit complicated, but what I mean by that is that some aspects of many malaria programs are financed and delivered in parallel. And that can be effective, but it can also be a bit costly and it's not very sustainable. So then the conversations that sort of led to a conversation about the 32,000 village workers that exist in the greater Mekong sub-region. Now, because the countries have been so successful in pushing down the malaria rates in that region, 90–95% of the fever cases that these village workers see are actually not malaria. So then the patients are turned away and they have to go to a health facility. Now here we have an entire cadre of people who could actually be mobilized to not only treat malaria or to detect and treat malaria, but also other infectious diseases, including COVID. So in that sense, it could almost be an opportunity for us.
Rima, Patrick talked about the funding issue, and I think this is going to be a very important part of our discussion today because it's critical. One of the things that I'm seeing here in Southeast Asia, close to where Patrick lives, is that all of the attention has turned to COVID. And, you know, where there was public awareness campaigns about various other, you know, illnesses and diseases and contagions, that's no longer present at all. And that's an indication that COVID in so many ways is sucking the oxygen out of the discussion on other pandemics and other viral diseases and contagions. So talk to us a little bit about what are you seeing in terms of the battle for funding at the national level, at the donor level, at the multilateral level, at various levels where funders you know, are thinking about where to allocate their resources in the year ahead.
Yeah, it's actually it's an awful situation where we're at currently, because there's already a global gap of about 3 billion annually without the COVID and the resources needed to achieve the targets in the global technical strategy for malaria. And then, as you know, in many of the low middle income malaria countries, external donor funds make up more than 50% of the total financing needed. So although the Global Fund is allowing countries to use existing grants for COVID, and they've actually made additional funding available, as you mentioned, there is the fear that that COVID will suck all these funds out of other programs, out of critical malaria programs. The other issue is obviously that bilateral donors are also facing the economic fallout. We've seen UK is the lowest deficit since the last 20 years. The same thing with the US. So they are all unlikely to increase allocations in the coming year. We're going to have to really rethink our strategy for resource mobilization, given that, Africa's already, or African Asia, both in terms of the low middle income countries, are already facing a decline in their own revenues, national transfers. They have a high debt to GDP ratio. And they're also facing high costs of borrowing, depreciated currency. So in terms of sort of financing going forward, I think it's just going to be important to keep the conversation alive, continue to ensure that there's a level of advocacy at keeping resources for malaria going. Otherwise, we risk losing the progress that we've made since in the last 15, 20 years. And we risk a resurgence. So then we end up with a double whammy of COVID, which isn't likely to go away for a while, but then increased cases of malaria because of withdrawal of funding. So we are going to have to rethink the way we do business. We can't rely on only multilateral and bilateral sources. And this is where, other partners become important. Innovative financing becomes important. The private sector, for example, has a lot to lose because malaria affects health workers. So yeah, we're really going to have to ramp up advocacy to the non-traditional donors to ensure that we can keep the message alive and keep our progress going.
So Patrick, you work a lot with non-traditional donors in the business space, in the private sector space. How feasible is that, do you think, to be able to recruit new stakeholders into the fight against malaria when those stakeholders, as Rima pointed out, are under enormous pressure themselves, both because malaria is not the only issue that they're being approached about. They're going to be approached about HIV, dengue, any number of causes that are also facing the same challenge. How do you have that conversation about malaria so that it stands out and is able to attract new stakeholders?
Yeah, I wish I had a good answer for that. That's a really tough
well,
question.
Put the crystal ball and do your
I mean, I think something that Rima mentioned, the question is really, how do you create that political urgency and how do you sort of sustain that? And I think, again, there's no clear-cut answer, but I think we all have different roles to play. I mean, the Global Fund, for example, have incredible leverage because of the funding. They invest in malaria, so they can sort of mobilize the political capital, the political will, but also financial capital using counterpart financing policies. I mean, organizations like APMA, for example, can work with ministers of finance, defense, foreign affairs to really create a whole of society approach and together with the corporate sector. Now, with the corporate sector, that's an interesting question. It's an important question. We worked quite a bit both with development banks, but also with the corporate sector. And the way we have approached that type of private sector engagement is that we started an initiative called M2030. And that initiative is both a movement and a brand. So businesses essentially sign up and when they do, they mobilize money and raise awareness using their own infrastructure. But the most important factor about M2030 is business leadership. So we recruit the CEOs as malaria champions. And that for us has been important because these are CEOs and founders that are admired here. They have, they have an important voice. When they speak, what they say matters. And together with the World Economic Forum, we created a Champions Council that sort of really elevated this dialogue, not only private, but also public-private with government leaders. So this, together with the media, together with silent diplomacy, has helped for us at least in putting the spotlight on malaria and making sure that other voices are talking about elimination. I think, if I can say anything, I find that is important. I feel like sometimes as a community, we're a bit insular. We talk to each other, they're already converted. Like I'm listening to the dream, I'm like nodding, yes, makes sense. But it's not me who have to be convinced. So I think we need to create these other champions to speak about malaria. And one way is to engage these corporates, the corporate sector.
And earlier I had the chance to talk to Caroline Desrousseaux, co-chair of the Business Alliance and a director at Vestigas. Caroline, thank you so much for joining us today. We really appreciate it.
Well, thank you for having me.
Well, Caroline, let's talk about, in the context of the COVID-19 pandemic, what role does the private sector play in ensuring support for malaria programs is continued and even bolstered?
our first task is to ensure that we continue to reliably deliver quality products on time. Preserving the supply chain is the private sector's primary contribution to ensure that the malaria programs stay on track. Very early on in the epidemic, WHO warned that severe disruptions to bednet campaigns, to access to anti-malarial medicines could lead to a doubling in the number of malaria deaths in Africa this year compared to 2018. So it is of critical importance that all companies that supply health commodities that help prevent malaria or treat malaria actually deliver on the promise. At my company, Vestergaard, we made our utmost to ensure that our malaria bed nets would be manufactured on time and reach populations at risk of malaria before the continent was hit by COVID-19. Thankfully, a recent report from the Global Fund has showed that malaria has been the least impacted of the three diseases by supply chain disruptions. Beyond the preservation of supply chain, the private sector is also a critical partner to invest in innovations that can have greater impact, make the money go further, and accelerate progress towards innovation. COVID-19 makes this imperative even more urgent, as there is no doubt that the global health funding landscape will be affected by the current pandemic in ways that are yet unknown. Finally, when it comes to our BAM members, I'm very proud of the fact that the members of the Alliance have contributed in many ways to helping with the pandemic and their malaria activities at the same time. Activities have ranged from R&D of vaccines and therapeutics to various in-kind and financial donations to adapting business operations, and of course, sustain advocacy at all levels.
Yeah, that's very interesting. Now, I've heard that BAM is going to be releasing a business case for malaria. Is there anything that you can share at this stage as to what you would say to other folks in the private sector and why they should engage in malaria?
I think the COVID-19 pandemic has made apparent the linkages, the dependence between business and health like seldom in the recent past. And it's probably transforming the relationship between the business community and health. It's providing a strong rationale for engagement. When it comes to malaria, the business case starts with a simple acknowledgement that we can end malaria. We can end malaria for good. And we've been able to make an incredible amount of progress in the last decade. The opportunity can even be quantified in numbers. We know that every dollar invested yields approximately $40 in economic returns. So meeting the 2030 targets for elimination could actually generate a $2 trillion boost to the global economy and save 10 million lives. But in order to deliver on that vision, we need a whole of society approach, and we need businesses to engage, to do their part. They've got a lot at stake in making societies healthier, but we know they don't engage in health as much as probably businesses could and should. And so we are making all of those arguments in our business case report. And we hope that it will serve as a booster for more private sector to join our efforts. We're trying to address those businesses that maybe do not yet fully appreciate that they may have an interest in engaging on malaria and global health. I'm thinking of the travel, the tourism sector, the communications companies, but we are also thinking of companies that are uniquely placed to help address some critical challenges like improved advocacy or distribution through technology, such as those big giants that are Google, Facebook, or Amazon even.
Caroline Desrousseaux, thank you so much for taking the time to join us out of your busy schedule. Caroline is the co-chair of the Business Alliance and a director at Vestigard. Thanks for your time today. Joy, I follow COVID very closely in Africa for the work that I do on the China-Africa project. And one of the things that I've noticed is that politicians today across the continent are being evaluated on their handling of COVID. They're not being evaluated on their handling of pretty much anything else. And this idea that Rima and Patrick brought up about making malaria a political priority in order to ensure that the funding, the attention, the resources remain in place. Maybe today they're remaining in place because of inertia from last year's budget, but we're really worried about next year and the year after what's going to happen. So how do you see it in terms of a political priority right now in Africa? And what are you going to do? And what are you talking about with your various partners about how to ensure that this stays on the agenda?
When countries started locking down, which was in March, when African countries started doing their lockdowns for COVID-19, he wrote to every single head of state and told them that they must protect the budget allocation to malaria, and they must make sure that malaria programs are not interrupted. But in addition to that, I called on the CEO of RBM, the CEO of the Global Fund, and we wrote follow-up letters to all the ministers and committing to supporting the ministers. Now, 85%, 27 sub-Saharan countries responsible for 85% of the malaria cases on the continent have to do LLIN distributions and IRS this year. And we have been making sure, working together collectively as countries and as partners, and supporting the ministries to make sure that each country does do the LLIN distribution and carries out the IRS. It has not been easy. It has meant, for example, that we have had to have some countries helping other countries. We have, President Kenyatta has written to other heads of state of countries. So malaria on its own, before COVID, has a huge impact on gross domestic product. So the private sector is very, very keen to engage. When the anti-malaria fund was established in Eswatini, or what used to be called Swaziland, 50% of the budget now for malaria comes from the private sector. And you find countries like Zambia, which also have got funds, which have established malaria funds, where the private sector is playing a very, very, very active role. First Quantum Mining, for example, in Zambia, is financing logistics support in the provinces and has transported IRS commodities from the center to the province. The Zambia Revenue Authority, when it repossessed vehicles from people who are not taxpayers, who are not paying, they actually donated those vehicles to the malaria program about 2 months ago. So the private sector is becoming actively engaged, and we are using the establishment of national and malaria councils to more effectively engage the private sector.
Joy, let me hope your connection comes through, because there's just one question that I'm really keen to ask you about, which is, you've talked about the role of the private sector, and that 50% of the funding, you said, in some communities is coming from the private sector. But those private sectors are now operating in economies that are facing the worst recession, if not a depression, in decades, if not centuries. How are you worried that level of engagement will continue next year when the economies are so bad in many sub-Saharan African countries?
I believe the private sector does not have a choice because of the impact, particularly in the highly endemic countries. The countries that have got low malaria endemicity, like Botswana, South Africa, Namibia, Eswatini, might be a little bit more challenged. But the countries that have got high endemicity, the high burden countries on the African continent, the private sector has got no choice but to engage. In fact, in countries like Uganda, the private sector itself launched a fund the end of last month. and they themselves called in the members of parliament, and we are seeing the same thing in Kenya. So the impact of malaria on private sector productivity is massive in the African continent. So the private sector has to engage. It doesn't have a choice.
Rima, Joy has made the case that in Africa, there's clarity on the role of non-traditional stakeholders to be involved in this. As somebody who works in the global health community, do you also feel that there's that clarity? Or when you head up into places like Oxford and the United Nations and Paris, London, and the major kind of donor capitals, COVID is on everybody's mind. Is that same clarity of purpose also there that Joy is seeing on the ground in sub-Saharan Africa?
I think there's a level of clarity, but at the global level, I still think that there's work to be done, because they're not engaged on the day-to-day business of combating malaria at the country level, where they don't have their daily employees calling in sick because they have malaria. So I think there's still work to be done at the global level. But that needs to obviously, in parallel, the work at the country level needs to continue, and the case for investment needs to continue. And there has been a number of pieces of work that have been launched by RV and by WHO and actually ALMA as well on quantifying the impact on private sector, quantifying the impact of malaria on private sector. So that definitely needs to continue, and the messaging that accompanies the economic impact needs to continue as well.
Let me just follow up very quickly with you, Rima, on a somewhat sensitive issue, but I'll ask it as the lone American on the panel here today. Mm-hmm. Traditionally, the United States has been a leader in global public health, and certainly the President's Malaria Initiative has been something that has been a benchmark for many other countries. But the current administration has gone a more unilateral approach in its foreign policy. It's also withdrawn from the World Health Organization. Do you see any changes in the U.S. contribution to this effort, or the fact that under the Trump administration, it hasn't seen aid and public health as a priority as maybe previous administrations may have?
I mean, we've had obviously in the budget cuts previously that impacting CDC and other aid, but the President's Malaria Initiative continues to work in the countries that in its priority countries. What happens next year will depend on Congress's allocations, obviously, but we're hoping that the allocations will continue to the same effect, to the same magnitude, and the work that PMI is doing in the countries through its partners will also continue. Obviously, it's a yearly allocation, so we really don't know what will happen for the coming years in terms of malaria allocations to PMI. But we all try and do our best to ensure that Congress continues to understand the impact that malaria has in African countries, and then again, we're one world. If anything that COVID has taught us is that what happens in one country or in one continent affects all of us. So hopefully that message is clear.
Yeah, so Patrick, here in Asia, it's a little bit of a different story, in part because we're much closer to China. China, interestingly, has made malaria a priority. It's one of the issues that they've done quite a bit of work in Africa and also in China itself. Is China playing a role that you're seeing that might change the equation of this in terms of looking at non-traditional stakeholders? What's the role that China's playing in all of this?
I think that they're playing an incredibly important role of course, in the global arena, in Asia as well. Perhaps a bit less when it comes to malaria in Asia. I know that China has had a strong interest in investing in public health and malaria in Africa, but to much lesser extent in Asia. So here, the investments we see mostly, with the new Silk Road, for example, has to do much more with trade and investments rather than public health programs.
And if I may just add to that, I mean, the other thing that China is involved with, not just Asia, but generally, is in research. So they certainly have played a really important role in sort of, for example, they have their developing strategies that obviously impact on everyone. They implemented the 137 strategy in terms of diagnose, treat, and track, which a lot of countries in Asia then also adopted. So not just in terms of financing, but in terms of establishing of best practices, I think they have played a role. And through APLMA and other stakeholders, these strategies have been rolled out to the rest of Asia.
And Joy, in terms of what the Chinese have done in Africa, obviously they did a big rollout in the Comoros Islands, and also they're talking about engaging Kenya also in some initiatives to fight malaria. What are you seeing in terms of the Chinese presence in Africa as it relates to the campaign against malaria?
I'll just share with you something. As we saw our financial years ending, some of us, our financial years end in April, some in March, some in June. What has been becoming evident is that tax revenues have plummeted, which means that even the little contribution that we have been making as African countries to our malaria budget is going to dwindle, because if 10% of the health budget was going to malaria before, and the health budget was let's say was 20 million. Now, if it's reduced because of reduced tax revenues to 5 million, it means that the 10% that goes to malaria is going to be less as well. And this is going to happen across the continent. So our biggest fear, like you were saying earlier on, is not what is happening now, because the budgets were already set, but what is going to happen next year when the pot is smaller. It's not going to be that we won't be prioritizing malaria, but the money won't be there. Now, President Kenyatta wrote to the Bretton Woods institutions to ask them to forgive some of the African debt, because Africa, the biggest expense in any African budget is debt repayment. And one of the biggest lenders to the African continent is China. Some countries are seriously indebted to China. Now, this huge debt burden is the biggest stumbling block to health programs, sustainability of health programs on the African continent post-COVID-19. And China is one of the big lenders too. So for me, the biggest contribution that China can make is for giving its debt to Africa. That's the biggest contribution that they can make.
That is a big ask. It's a big ask, but we haven't seen, unfortunately, I'm sorry to interrupt you, Joy. Unfortunately,
but what is the option?
Movement on that. I mean, just to bring up your point here, the Chinese have made it pretty clear that they're not going to forgive. They will restructure and reschedule, but they're not going to wipe out. And President Kenyatta is by no means alone as an African leader. Macky Sall in Senegal just recently made the similar appeal, because he's saying we cannot support both public health initiatives and the debt service that we have to provide right now. But okay, that is the hopeful, wishful side of things. Patrick, if things don't work out, and the fact is that the money for malaria is going to be raided potentially, as Joy pointed out, there are debt issues that are also very prevalent here in Asia as well, where there's competitions on the budget. What are we looking at in the next 1 to 2 years if malaria funding starts to decrease, as it may in fact do, just because the economies and the money isn't there to do it, and it's not the political priority that you're suggesting it should be? What are we looking at, Patrick?
Well, so looking into the crystal ball, it can always be a bit treacherous, but last week at Malaria Week, we talked with financing experts from ADB as well as WHO, and as you pointed out, Eric, the economic depression that we're in right now is much worse than the Asian financial crisis in 1997 to 98. So much worse than the global financial crisis in 2008. We know that eventually the economy will rebound, but the question is, how will it rebound? Is it going to be a V-shaped recovery, or will it be what they talk about, like a Nike swoosh type of long tail type of recovery? But during this time, regardless of how long time it will take, we absolutely need to safeguard, malaria funding. And in this last, in the session we had talking about malaria financing, I think there were a couple of strong agreements that came out about what we need to do as a community. And one of those issues was that we need to show results. We need to spend the money effectively. We need to demonstrate that malaria investments also help build systems that prepare countries for pandemics, that help countries to pick up and treat other infectious diseases. We also need to make sure that we defend routine budgets for malaria, meaning that HR, supervision, surveillance, all of that has to be absolutely in there, because if that funding is disrupted, then we risk a resurgence, and that would be devastating. Now, if we look at the large sources of funding for malaria in this region, we're looking sort of really at three large sources. One is the Global Fund. Even though, okay, let me start with the Global Fund. If you look at the donors of the Global Fund, they have all sort of said that they would honor their commitment. The replenishment of the Global Fund happened recently. We know that the funding from the Global Fund will continue for at least 3 years. So that's a good thing. That's a really important thing. But last week, we also heard a word of caution from the Global Fund that following these 3 years, it is likely that money for malaria, for Asia and the Pacific will be reduced. So the Global Fund, the message from the Global Fund was as well, governments, you need to step up, you need to invest more in the malaria programs. But there will be this sort of little bit of a grace period over the next 3 years, at least, with like sort of significant funding from the Global Fund. The second big source we have is domestic funding, the tax revenues. And I think we have much greater sort of concern, as Joy mentioned as well. I mean, looking at the tax revenues plummeting, looking at the expenditures going up, in situations like this, ministers of finance will look really hard for cost cuttings and savings. And here I think the importance of just going back to political will, to make this issue a political priority will be absolutely critical. And our ability as well as a community to show results and demonstrate that investments in malaria is a good investment. The third sort of large source of funding is what Rima mentioned, the President's Malaria Initiative. They still have some programs in the region, but that's pretty much it. Like the other large donors like Australia and Japan, the development banks, they do invest in public health programs, but not so much into malaria programs.
And Rima, how do you defend that funding? What's the message?
I think it's a very clear message. Of course, couched within the current context. So first of all, malaria affects productivity. If you have loss of productivity, you have less people going to work. At a household level, that means that you have less disposable income and less consumer spending. So from a private sector's perspective, if there's less consumer spending, it becomes a vicious cycle. The products that the private sector is putting out there in the countries won't be bought. So I think that message has been packaged, but maybe needs to be repackaged to appeal to the private sector. But then again, from the perspective of the donor, the UN projected that foreign direct investment could fall between 5 and 15% over the next few years. Well, that will put low and middle income countries at such disproportionate amounts of losses of income and risk of poverty. And we have the Sustainable Development Goals that the whole world has actually subscribed to, and leave no one behind. So it ought to be in the interests of bilateral and multilateral donors as well to continue to fund countries in their malaria fight, and perhaps even forward fund allocations that haven't even been made yet, in the hope that we will catch up and we'll have a V-shape rather than a U-shaped recovery after at the end of the pandemic. But one of the things to also just to put out there that as we kind of are talking about a second wave of COVID, the appropriateness of some of the measures, lockdown measures that have put developing country and low middle income country economies at a disproportionate risk of poverty may not be appropriate because of not only the socioeconomic context, but these countries have very few people living over the age of 65 years old. Just as an example, Italy, I think, is about 24% of the population is over 65. Uganda is 2% of the population. So to rethink some of the strategies as we potentially go into the second wave of COVID, particularly around mitigation strategies and lockdowns in low and middle income countries, so that we don't, we don't compromise the economy as much as we did a few months ago when some of these countries went into lockdown, sort of copycatting some of the Western countries.
So we started our discussion at the beginning talking about how we're at a crossroads right now. And I think what we've heard over the past hour is that crossroads is really a huge intersection. We are looking at now, we don't know which way COVID is going to go. The economy is a big question. The stigmatization of COVID that impacts healthcare is a big question. As Joy pointed out, the fact that private sector remains a very important player, but will it stay so given the fact that economic pressures are going to be enormous on the corporate sector going forward? And at the end of the day, it's really going to be very difficult to foresee. Patrick mentioned that he doesn't have a crystal ball to look ahead. Nobody does. And it does seem like there's a battle right now for making sure that this, malaria is fighting alongside HIV, is fighting alongside dengue fever, many other worthy causes for attention, given that tension is very, very limited in this time when everybody's focused on COVID. I'd like to wrap up our discussion with a takeaway so that people who have been watching this, we've been all over. We've talked about a lot of different issues, and I'd like each of you to give one key takeaway that you want people to leave this discussion thinking about. What do they need to know about the campaign against malaria in 2020 going into 2021? Joy, let's start with you.
Well, my takeaway message is that we have to eradicate malaria. The fact that we are having a huge pandemic while we are still dealing with malaria makes it more expensive to deal with that pandemic, and it puts an additional stress on the health systems. So we have to eradicate malaria. And over the next 10, 15 years, we must focus on universal coverage with prevention strategies that are because that is a much cheaper way than treatment. And when it comes to the treatment, we must have an integrated approach to make it as cost-effective as possible. So we have to have integrated case management approaches. We have to use the private sector for logistics, supply chain management. We have to do bulk purchasing mechanisms in order to ensure that we reduce the costs of products. We have to ensure that we make the little resources that we have, because we are going to have less resources no matter how we look at it. There will be less resources globally and nationally. We have to make them work efficiently for us. And we must engage every single partner in doing this. And I think that is the main lesson, takeaway message that we must take away from this. COVID-19 is not the last zoonotic pandemic that we are going to experience. Another one is coming. Let's learn a lesson now. Eradicate this disease so that the next pandemic, when it hits, our health systems are better prepared and better equipped.
Patrick, what's your takeaway?
Can I just copy Joy? I thought it was a wonderful message. but I think my message would also be to just complement Joy's fantastic message, is that we need to sustain funding for malaria. And this is not a matter of cannibalizing on other public health priorities or other social sector priorities, but it is about defending all public health programs, but in particular those that are pro-poor, that are providing protection for the poorest amongst us, and where the investments can also help beat the COVID-19 pandemic. And malaria programs do exactly that. And the other message is that malaria can be researched really quickly if we reduce the pressure on the disease. It's happened many, many times in the past. That would be devastating. We would lose years of progress and lose years of investments as well into the disease. So let's sustain the funding for public health and malaria programs.
And Rima, I'm going to give the last word to you on this.
Well, you've made it very difficult for me because everyone said what needed to be said, but maybe just to reiterate, absolutely, it's although a lot of the countries are using their existing funding and deviating it to COVID, they absolutely need to advocate for new funding to fight COVID in the longer term, but also to replenish the funding to continue to fight malaria, as Patrick mentioned. Malaria has provided a good return on investment. There's a number of studies that have been done on that. We know that in terms of economic loss and economic gain, eradicating malaria provides huge economic gains globally, and it impacts on not just the countries in question, but everyone that exists. And then touching on the issue of pandemic preparedness, as Joy said, using the opportunities and the lessons learned from this process to ensure that we are better prepared in the longer term, that we use integrated systems to ensure that we're able to detect the pandemics early and able to respond early through whether it's through stockpiling and ensuring that products are available, but also making sure that our human resources are protected to be able to respond to those challenges. But one of the pet issue of mine is efficiency. Continuing to work on measures to make sure that we get more malaria programs for the money, and more health for the money that we're putting in, whether it's through integrated approaches or looking for other opportunities to promote efficiency.
Well, we've covered a lot of ground in this discussion. I want to thank all three of you for taking time out of your very, very busy schedule for joining us today. So Rima, Patrick, and Joy, again, a very gracious thank you for your time and your expertise on this issue.
Thanks, Eric. Pleasure.
And I want to thank all of you for joining us for this webinar series. Again, we're going to be having other discussions coming up in the future on the issue because, again, we're at this crossroads and we have to keep exploring this issue from all different sides. And so I want to thank you all for joining us for this webinar, and we'll see you again soon.